Now, the human study, the top results under the supervised trial was that 45 people completed it, the 6-week study, and a positive results were evident across the board. So positive lab results, positive functional results, and positive attitude. A study was not randomized or held as a blind study of control subjects without knowledge of the product or its potential benefits in advance. The overall findings under key observations was major reduction in triglycerides, amazing changes in cardiac risk profile. Because as you know, when you watch those commercials, cardiac involvement is inevitable for diabetes patients. Much better control of hypoglycemic patients, blood sugars going back to near normal or normal. Excellent blood sugar maintenance for 99% of pre-diabetic and diabetic type 1 and type 2. 99% improved diabetic and pre-diabetic hemoglobin. Those are all measurements that you're familiar with when you're in the diabetic range. 71% of kidney and liver function changed to become normal. Now, the last 2 years, I've had blood in my urine, meaning kidney involvement. They spent a lot of time trying to find it, see what was going on, and said, it's probably one of your medications. So you have a medication that destroys your kidneys? That doesn't make any sense at all. So my kidney labs showed clear urine, meaning that my kidney involvement is gone. And that's amazing to me because I spent 2 years visiting a urologist, going back to my well, you know how it is. 2 participants in the study of the 45 people did not need transfusions at the end of the 6 weeks. And that's amazing to me. Body fat reduction in almost all participants. That personally has been amazing to me because I have spent a lot of my years as a thyroid patient, as a lupus patient, taking medications that cause a weight gain. I spent my time in the gym. I've spent my time at home. I've tried to do diets. None of it worked. And at my age, it's not surprising because normal individuals would have problems at my age. But I had a bigger challenge. To lose 13 pounds in 30 days is pretty amazing. Continuing on, a large reduction of C-reactive protein, meaning the organs themselves has reduced inflammation. All results were seen within the first 3 weeks, and then continue on dramatically to the conclusion of the 6 weeks. Now, 100% indicated major lifestyle changes, like I was talking about. This was observed within the first 2 weeks. Things like increased level of alertness and energy. Energy, we all want more energy. I can attest that my energy levels have gone up. And I do go to the gym, but I'm doing more at the gym. I'm doing more around the house. They also stated that their mood had improved and they're participating in exercise voluntarily, primarily walking. So these were individuals that maybe didn't have a workout routine. So let's talk about workout. Many serious workout people, serious competitors, have a pre and post regimen to be able to go forward and accomplish their goal. So Pondera being that energy giver, Pondera being better blood circulation, it is a pre and post product. And I know this because I've used it. Now later on we're going to talk about CBD, which is a complement to Pondera, what we call a recipe for wellness. So this pre and post routine is to be able to get the energy, get the good blood circulation, but do it comfortably without pain. Maybe joint pain in the knees, if you're running, in the arms, if you're playing like tennis. Generally, where you know your body has some limitations, CBD oil will take care of that. Now, the last thing we're going to do, and like I say, on the website is the very detail of all this information, and I just summarized it. We're going to look at 5 different individuals that participated. One is a 68-year-old male, history of leukemia, with cholesterol elevated. And so what their numbers were, or his numbers were, is the HDL cholesterol from 7 to 14, as you can see on the screen. The triglycerides from 279 to 200. Cardiac risk, that means his risk for a heart attack, went from 16 to 8.5. Glucose, that's your measuring of blood sugar, 146 to 73. So of course his risk factors will go down. The BUN from 45 to 37. The AST from 29 to 21. Like I said, I'm not a medical professional, but at least if you're watching this or if you're listening to this, you'll understand what those things are. Red blood cells from 3.5 to 3.8. Hemoglobin from 10.6 to 11.0. And the platelets from 57 to 139. We're looking at participant number 3, a 45-year-old male. This patient's doctor stopped all diabetic medication upon completion of the study. In 6 weeks, he was able to get off whatever medication he was taking for his diabetic condition. Participant number 3's cholesterol from 156 to 144, triglycerides from 264 down to 124. Cardiac risk is 8.5, which was participant 1's good number, but that's participant number 3, 8.5 down to 3.6. So half a step each time. Glucose from 123 to 80. So you're seeing some real improvements here. It proves this product works. Hemoglobin A1C from 6.4 to 5.8. The BUN from 15 to 13. Creatine from 108 to 87. Blood pressure, and this is a considerable, 152 over 86 to 126 over 78, under the normal range. Weight loss from 207.7 to 190.7 in that 6-week period. So very similar to my proof on myself. Participant number 5 is a 30-year-old male, cholesterol level from 211 to 169, for triglycerides from 552 to 109. Hemoglobin A1C from 5.6 to 515. Cardiac risk from 23.0, that's a very dangerous level according to Dr. Sterling Wood, to 5.19, extremely significant results. Creatine from 0.87 to 0.85, AST from 25 to 18, hemoglobin from 16.4 to 15.1, and C-reactive protein from 0.63 to 0.40. Patient number 13, 44-year-old female, had an infection during the trial, so you should have seen some elevated numbers. So aside from clearing the infection, during the Pondera trials, her AST went from 20 to 17, her ALT went from 23 to 17, her C-reactive protein from 0.07 to 0.71. Her blood pressure went from 123 over 88 to 121 over 69. So Again, when your body starts working properly, you don't put that strain on your heart. Weight loss from 218 to 212, and she had significant body fat loss. And you always see that in advertising, body fat loss. And I can attest to that based on the clothes that are fitting now. Participant number 24 is a 55-year-old male, and Dr. Sterling Wood wanted me to emphasize this one. His lower leg edema from a vein removal for his current cardiac bypass was markedly improved. So the edema, the swelling, the blood, the fluid contained in the legs were markedly improved. But aside from that, he had suffering from eczema in his entire lower part of his body. The eczema on the lower extremity disappeared. So, miracle drug, well, I can say that they all tout that. But as a skeptic of 30 years of a chronic illness, I can say that it's proven in the study and by my use in the last 30 days. Now, the website for Pondera Wellness is ponderawellness.com. That's where you can order the product. There's a discount code you can use. It's USA. And all of the pricing is indicated on the website. Now, the second part of the presentation has to do with natural botanical CBD hemp oil. Now, we talked about a recipe for wellness. So where Pondera goes to the cellular level to improve the body and blood circulation, the CBD addresses pain, anxiety. Now you see CBD sold on many corners in many stores. Our CBD is a powerful plant-based CBD, and it's been fully tested to the trillionth, parts per trillion. Now, one of the things, if you read somebody else's CBD, it will say something like, dilute our pure CBD oil with coconut oil, and they claim it optimizes absorption. It optimizes their margin. Ours have had no dilution of anything. We wouldn't pass those tests if it did. And it's absorbed perfectly fine. It's derived from a USA grown non-GMO agricultural hemp manufactured in a CGMP facility, lab tested and certified. And I, again, can attest to this because I do use it for pre and post workout, but most importantly, I use it for my morning stiffness, which is now just in my hands, and for my evening to eliminate any pain while I sleep, because I've spent a lot of years where pain wakes me up, interrupts my sleep. Now, it has no THC. That means it's not psychotropic. It can be ingested. It can be applied topically. Has healing properties, and it's safe for you and your pet, your cat, your dog, my horse. It gives them energy. It reduces anxiety for them. It's important to know that your pet has similar types of conditions that causes a lot of their daily stress. It's good for joint and muscle relief, headache relief, anxiety, cramps. It's a sleep aid. It addresses neuropathy. I told you I have 82% of my restored feeling in my legs, but it's sometimes uncomfortable. Restless leg, I will use it for that. Cramps. Pre and post workout or game. and arthritis type symptoms, morning stiffness, or acute joint pain. So it's good for all these things. Now, again, the website itself is going to have the detailed information. It also will have the contact information. Again, I'm Joni Dee, and if you have any communication difficulties or you want more information, you'll be free to call me or email me. It is on the website. Thank you very much. I hope you understand that this is not just any snake oil. This is the real stuff. And unfortunately, because of every product preceding this has believability problems, I want to assure you this is from a personal goal that I'm accomplishing now. Thank you very much.